Welcome to the Explainer. Today we're tackling some of the absolute trickiest chapters in medical coding. You know the ones, chapters 5 through 8. We're going to break down those dense official guidelines into something you can actually use, cutting through all that complexity so you can code with way more confidence.
All right, let's just jump right in with a classic coder's dilemma, one I'm sure you've seen a million times. And look, this isn't just some textbook question, right? Getting this right can literally make or break a claim. So, what do you do? What's the right call when the chart gives you both?
So, here's our game plan. First, we'll hit mental health and substance use. Then, we're going to decode those tricky rules for pain and the brain. After that, we'll take a quick look at the eyes, and we'll wrap it all up with the one golden rule that kind of ties everything together. Okay, let's get into it. First up, Chapter 5. This is the one that covers all things mental, behavioral, and neurodevelopmental. And trust me, this chapter is just packed with specific guidelines we really need to pay attention to.
Remember that question from the beginning about alcohol abuse versus dependence? Well, the answer lies in this super simple but absolutely critical idea called the hierarchy rule. Seriously, this is one you'll want to lock in.
So here's how it works. The guideline is crystal clear. If the provider documents a few different patterns for the same substance, you only, and I mean only, code the highest one on this list. So for our first question, alcohol abuse and dependence, you just code for dependence. That's it. It's at the top. It wins.
Okay, let's switch gears to another really tricky spot. Factitious disorders. Now the key here isn't just knowing the definition. The real trick is that the code you pick completely changes depending on who the disorder is being imposed on.
And you really got to pay close attention here, especially for the by proxy cases. Here's the deal. You never assign that F68.8 code to the victim. That diagnosis code, it goes on the perpetrator's record. The victim gets coded for abuse. This is such a critical detail for keeping patient records accurate. You can't mix this one up.
Now, this slide shows a really important detail for when pain and psych factors are connected. It's subtle, but it's huge. If the chart says there's a psychological part to their pain, you can code both F45.42 and a G89 pain code, no problem. But if the documentation says the pain is only psychological, then you absolutely cannot use a G89 code. It's one or the other in that case.
All right, let's keep moving. We're heading into Chapter 6 now, the nervous system. This is where we get to tackle those famously complex G89 pain codes, plus a few rules about left versus right side.
First off, a quick but super handy rule of the road. Think about something like hemiplegia. If the doctor notes the affected side but doesn't say if it's dominant or not, this table is your cheat sheet. For a right-handed person, it's simple. Right side defaults to dominant, left to non-dominant. Pretty straightforward, right?
Okay, here it is. This is the big one, the million-dollar question for this chapter. We all know we can use G89 codes, but when? When does a pain code get to be the star of the show, the principal diagnosis?
It's actually pretty simple. It all boils down to the purpose of the visit. Why is the patient here today? If they're there specifically for pain control, maybe getting a neurostimulator put in, then boom, the G89 pain code is your number one. The underlying cause? That becomes the additional diagnosis. The why of the visit is everything.
And speaking of pain, here's a huge rule for post-op pain. This is a big one, so listen up. Routine, expected post-operative pain, the kind that happens right after surgery, you do not code it. Let me say that again. If it's a normal part of recovery, it doesn't get a code. You only code post-op pain when something's off, when it's a complication or not what the doctor expected.
Okay, next up, we're jumping into Chapter 7, Diseases of the Eye, and we're going to do a quick rapid-fire round on glaucoma. Because for this condition, precision is everything. You've got to get the type, the eye, and the stage exactly right.
So the guidelines here are all about specifics. Think of it like this. If a patient has the exact same type and stage of glaucoma in both eyes, great, one bilateral code and you're done. But what if the types are different, or the stages? Then you need two separate codes, one for each eye, to tell that full story. Oh, and if someone's in the hospital and their glaucoma gets worse, you always code for the highest, most severe stage that was documented during their stay.
Now lean in for this one, because this is a super common mistake. It's all about that seventh character. Indeterminate, that's character 4, means the doctor looked, but for some clinical reason, they just couldn't determine the stage. Unspecified, character 0, that's different. That just means the doctor didn't write it down. See the difference? One is a clinical reality. The other is a documentation gap. Huge distinction.
All right, we are in the home stretch now.
Just a quick word on Chapter 8, and then we're going to get to the single biggest, most important idea that really holds all of this stuff together.
And here's a little pro tip for you, something that'll save you a headache. Chapter 8, Diseases of the Ear. Right now, there are no specific chapter-level guidelines for it. Nothing. The space is just saved for later, so we can skip right ahead to the main event.
Okay, if you forget everything else we talked about today, please remember this one thing. This is the golden rule. From the substance use hierarchy we started with, all the way to staging glaucoma, the provider's clear, specific documentation is your Bible. It's the source of truth. It is the foundation for everything.
Because at the end of the day, what you do is so much more than just data entry. You're not just trying to get a claim paid. You are telling a patient's complete story. And following these guidelines, that's how you make sure that story is told accurately. It creates a record that can impact their care for years. That's how important your work really is.